1440 KVON and 99.3 The Vine. This is Kelly. It is time for Health Bits, sponsored by Queen of the Valley Medical Center and brought to you by Senior Helpers Caring In-Home Companions. Robert Nations is here from Senior Helpers. Good morning.
Good morning. I don't know if you know, I was involved in the weather this morning with Bob.
I know. That was exciting.
That was kind of fun. I get to help with the weather.
What was that all about? You got to look out the window and tell
absolutely.
us what's going on.
Yeah. Well, anyway, as you know, I work with the aging population here in the county, and one of the challenges we face, and I talk to the hospital quite a bit about this, is people bouncing back and forth. The aging population, they get sick, they go to the hospital, and they get out, and then suddenly they're back, and for the same reason. In fact, I read one article recently that said 19% of patients that get discharged to a nursing home, which is a full care facility, get readmitted within 30 days.
Wow.
They're back.
30 days.
They're called frequent flyers. Is a common term. And what I want to try and do as a community is see what we can do to help prevent this.
Yes.
And so one of the ways that I've done that has been working with Dr. Ju and invited him this morning to come and talk to us about what they do at Napa Valley Personalized Healthcare to help with that, with their patients. And so we want to talk about that. So welcome this morning.
Good morning, Bob. Thanks for having me. And good morning, Kelly.
Well, before we get started, let's talk a little bit about your background, because you're a California boy, grew up in Central Valley. So give us an idea where you come from.
That's right. Well, I grew up in Hanford, which is a little San Joaquin Valley town, and my dad was a pharmacist there. After college, I started my medical career there, actually, as an EMT. After that, I was off to medical school at George Washington University in Washington, D.C., and then I came back to California and did my specialty training in internal medicine at Santa Barbara Cottage Hospital, where I was chief resident. And I moved to Napa to establish my private practice in 1998. And that was pretty much a traditional practice until last year when I adopted this personalized healthcare model. And the personalized healthcare model is a model which allows me to spend a lot more time with each patient. And I really think that's important because it helps me to understand their health issues fully.
Right.
Well, one of the challenges as a senior is as we get older, and one of the statistics I've read, an average 75-year-old has 3 chronic illnesses. And with that comes multiple meds, multiple doctors, and that seems to be some of the challenges we have with this frequent flyer kind of thing.
You're right, Bob. And, internists are essentially doctors for grown-ups, and grown-ups tend to have multiple medical problems. A lot of people become collectors. Most 75-year-olds collect 3 or more chronic conditions, and maybe along the way they might collect some more doctors like a cardiologist or a gastroenterologist. And usually this means multiple medications prescribed by multiple doctors. And so, patients, I recommend that patients take their medication list to all their doctor visits and take it to the hospital if you get hospitalized too. That way all the doctors can be on the same page.
Yeah, I can't imagine being an emergency room doctor and having someone come in and have no idea where this person's come from, what meds they're taking,
know what they're taking,
and how they treat them like that.
It's tough, and the ER docs do a great job with the information they get, and sometimes if I see a patient that's from out of the area, it's difficult, especially if the patient's unfortunate enough not to be able to talk, or if they don't have a family member with them, it's kind of hard to get the information sometimes.
And I think one of the key things, if I'm not wrong, is also to list your vitamins, the minerals, all those supplements you're taking as well, right?
That's right. And a lot of these medications that are over-the-counter or they're considered to be a supplement or a vitamin can have interactions with your prescribed medication. So it's really important to make sure that your physician knows all about everything that you take, not just the prescribed medicines.
And could I say that you mentioned that sometimes the patients come in and they don't have any family members, anyone to sit, they can't speak. Could they just make a list and keep it in their wallet, or women keep it in their purse? Because usually you have that with you.
They certainly could, and we give our patients a card that it folds up and they can put it in their wallet. Another thing that we do in our personalized healthcare approach is, besides doing a comprehensive wellness evaluation each year, we regularly go over each patient's medication list, including all those over-the-counters and vitamins and supplements, and we put all this information on a little computer chip, a flash drive. And it's small enough to keep on your key ring, and so the patients can take that essentially everywhere.
Great idea.
Isn't it a great idea?
Flash drive.
You can plug it into just about any computer and bring the information up.
That is wonderful.
So one of the other issues is when I'm getting discharged from the hospital and you don't really know what meds I happen to have at home. Yeah, I'm taking blood pressure medicine, and yeah, I need to continue doing it, but how many do I have at home? Should I be getting a new? Because they create a whole new med list at the hospital when I'm getting discharged. So how do we deal with that?
That's right. Well, like I said, it's a good idea to take your medication list to each doctor visit, and that includes if you ever have to go to the ER. So if you do have that list with you, or if you have one that's on the side of the fridge or somewhere that's handy, you could take it to the ER, and if you get hospitalized, they'll put that information into the database, and when it comes time to go home, we'll get that information and compare it to the discharge instructions that we actually write out and go over at the time of discharge.
Well, speaking of discharge, one of the other things that I've read is that a person leaving the hospital only hears about 40% of what they're supposed to do when they get home. Have you ever heard that statistic?
I've heard that.
That's crazy.
True.
Do you find that to be true?
I think that certainly could be true. Being in the hospital is often really stressful, and sometimes going home is stressful. Sometimes people have had surgery or something, and they're not sure how are they going to deal with the stairs or feeding the cat, so there's a lot of stress, and sometimes medications, especially pain medications, can make it even harder for a patient to concentrate on what's being said or to remember. So one of the things that we do at Napa Valley Personalized Healthcare is, I personally direct a patient's care all the way through their hospitalization, and I take the time to help the patients and the family members understand what to do and what meds to take after leaving the hospital. I personally write that information out. We stay in touch. The patients get my cell phone number if they want to call me.
Wow, that's impressive.
Isn't that impressive?
I got to tell you.
Yeah, in this day and time, it's very impressive, yes.
So anyway, that stress makes it really hard, and so I recommend that that a patient have a family member or caregiver present upon hospital discharge, just an extra set of ears and another brain to try to remember that information. And if that's not possible, then it's a good idea to hire somebody as a transition coach to help make that transition smoother to home.
Well, let's talk a second about how you got to this point, because it's one of the things that we talked about. I thought that was an interesting story. Is you were seeing patient going from examining room to examining room, but you weren't getting to spend enough time with them, and now you get to spend a lot more time with them. Do you not?
I do. As I said, I had sort of a traditional medical practice, but that's a little misleading because if you think about if you think about Marcus Welby, or you think about the old style, like the doctor I had when I was growing up, it was different. And unfortunately, when I went to medical school and my residency training, they don't really teach you as much about how it's really going to be like when you get out there, hang your shingle, and you've got to see a certain number of patients to keep the practice going. Right. And so, we were seeing quite a few patients, and we always tried to be thorough and so forth, but it's just a lot easier when you have extra time to really listen to the patients and understand their needs. And I think that's really made my practice a lot more satisfying for me and for my patients since we made this change last year.
Well, I think it becomes less intimidating when you go to the doctor and he's become more of a friend because you've spent some time with me, getting to know me, knowing more about what I'm doing, as opposed to flashing in and flashing out, I guess is how I would use the term.
Well, we're more comfortable.
Yeah, sure. We've really tried to make the environment a little more relaxing, a little more comfortable, and our visits aren't rushed because we actually schedule twice as much time as we used to schedule for regular visits and for our wellness evaluation. So it's a lot more comfortable. I think the patients are more relaxed.
And part of this philosophy goes back to the way you grew up. Your dad was a small-town pharmacist, knew all of his clients, knew them probably by name. So this kind of goes back to your roots, I think.
That's right. He had his own little drugstore for I don't know, maybe 34 years or so, and it seemed like when I was growing up, it seemed like everybody knew him, and he knew all of them, and he delivered medicines to their house, or if they're in the hospital, he delivered medicines to the hospital. It was just a real sort of mom and pop operation, and so that's the kind of familiarity with patients that I grew up with and I learned to really aspire to.
So this is one example of how the community is really coming together to help aid the aging population stop this frequent flyer kind of thing.
Right.
Doing personalized health care is one of the ways of doing it. Knowing your med list, taking it with you everywhere you go, having your doctor come to you in the emergency room, following you through the hospital, even through the discharge process.
Sure.
So it's an important transition as we go from hospital to home or to wherever we need to go. And Senior Helpers does it all the time. We have a transition coach. My RN goes and meets.
That's what I was wondering when you mentioned the transition coach, Dr. Jew. I thought, I wonder if they do that. As
yeah,
Senior
we
Helpers.
do that all the time. My RN goes and meets with the discharge planners and understands what the needs are, and then we follow the people home. We make sure that they got their meds at home. We make sure they're following up their follow-up appointments with Dr. Jew or whoever it happens to be, and make sure they're doing what they're supposed to do so we can stop that frequent travel, frequent flyer kind of thing.
Well, that's great. Thank you so much for being here, Dr.
You're welcome.
Jew.
It was my pleasure.
Thanks for coming in this morning.
Thank you.
If you would like to learn more, if we've piqued your interest, you can reach Dr. Jew through thequeen.org, which is the website of the medical center, or you can call 1-877-QUEEN-LINE. And if you want to learn